Good evening, everyone. I'm Tony Segreto, and honored once again to be your moderator for tonight's virtual In the Know Town Hall, and a very belated happy 2021. Tonight's discussion is on a topic that I know we are all still talking about, and in many cases consumed by COVID-19. Well, we have an update on where we are with the pandemic, the newest treatments, and the latest on the vaccine rollout. As you know, in December, the FDA issued an emergency use authorization allowing COVID-19 vaccines to be distributed in the United States. Well, UHealth, the University of Miami Health System, added to this milestone by launching a phased vaccine rollout following federal and state guidelines. Tonight, brilliant minds from UHealth and the Leonard M. Miller School of Medicine will help us learn more about these vaccines. They'll share an overview of how the vaccine works, the differences between the vaccines, and how UHealth is working towards the efficient immunization of those we serve. Especially now, this is so incredibly important as we face yet another surge in cases both here in Florida and around the nation. Our panelists will discuss all of this tonight. And speaking of our panelists, they include some of the most prominent experts here at UHealth. And leading us off will be Dr. Roy E. Weiss, Chief Medical Officer of the COVID-19 response, as well as the chair of the Miller School's Department of Medicine and a renowned endocrinologist. He will take part in the question and answer session, along with Dr. Suzanne Dublecki-Lewis, the Clinical Director of the Division of Infectious Disease in the Miller School's Department of Medicine, and Catherine Stella, the Assistant Vice President for Ambulatory Services and COVID-19 Operations. These are the people who are leading the university through this process. So needless to say, we are extremely fortunate to have them with us this evening. Now, before we get started, let's go over how you can participate in tonight's conversation. After Dr. Weiss has delivered his opening remarks, all panelists will answer the questions that you've been submitting over the last few days. But you also have the opportunity to submit questions during this program live tonight. And it's real simple. Those of you who have been with us before, you know the drill. Those of you who are new, at the bottom of your screen, you see a Q&A feature right there. All you have to do is send us your questions. We want to remind you all the questions will be anonymous, and then we promise we'll get to as many of them as we possibly can. But now, it is my honor and it is my pleasure to introduce Dr. Roy E. Weiss. And Dr. Weiss, it's always great to see you. Thank you for making time for us tonight.
Good evening, Tony, and thank you. It's my pleasure to be here. This is indeed a pivotal moment, not only in the history of UHealth, but really in the history of the world. We are truly in the diamond age of medicine today. When you think about it, it was just a year ago that the COVID-19, it was actually on the 31st of December that it was announced. If it was a day later, it would be called COVID-20. But COVID-19 was discovered about a year ago. And in the process of the year, we were able to diagnose it, figure out how to test for it, and then develop therapeutics and diagnostics for it as well. And now for a vaccine. This is truly a momentous occasion that we now have a vaccine, and it puts us to be able to see the light at the end of the tunnel. We're not at the end of the tunnel by any means, but we can see the glimmering of the light there. First of all, I want to recognize all the people that have been involved in this Herculean task, both here and throughout the United States and really the world, in developing these vaccines and developing these therapeutic interventions that we have. First, I'd like to thank Dr. and recognize Dr. Dipin Parekh. He's our Chief Operating Officer of UHealth, and I had hoped he'd be here tonight, and he hoped he'd be here tonight, but unfortunately was called away. With him is Mr. Joe Echeverria, our Chief Executive Officer. These two individuals have really led the army of individuals that were responsible for rolling out our programs here at UHealth. In addition to that, there's brilliant physicians, scientists, nurses, technicians, all of whom have been involved in the development of this program. And I especially want to thank our frontline healthcare workers. These are the individuals that come to work every day and go into the intensive care units and take care of the patients, putting their own lives at risk, taking care of patients that are COVID positive. Not just the doctors and the technicians, but the food service people that have to deliver food to the patients, and the environmental service workers that clean the rooms that these patients are in. All of these individuals together have come together in an unbelievable way to be able to fight this current pandemic. And as Tony mentioned, it's been a month since the FDA issued emergency use authorization, allowing both the Pfizer and the Moderna COVID-19 vaccines to be released. Let me just share with you a few thoughts. Here marks December 15th, 2020. It was a historic day by all accounts here at the University of Miami UHealth. Shown here are three of our first staff members getting the vaccine. On the left, you see Kimar Estes. She's the director of nursing in the emergency room in our UHealth tower and in the oncology care unit getting her vaccine. In addition to our nurses, you can see Anthony Adonicio, who is our director of food services, who delivers food to our patients. And on the right, you can see Veronica Valdez from our environmental services. These are just examples of people who are on the front line, in addition to our doctors and nurses, who we have to protect so that they can protect us and take care of us. So why are vaccines even necessary against the SARS-CoV-2 virus? First of all, we all know that this is a highly transmissible virus. It usually gets transmitted through the respiratory route by coughing or sneezing or breathing. And you can catch it by touching something that contains the virus and putting your hands inadvertently in your mouth or rubbing your eye are all ways in which the virus can get to you. It's also transmitted by people who don't even know that they have the virus. They can be asymptomatic or before they even develop symptoms. And it can become endemic, where that means they can reach a steady state of infecting everyone in the community. And the concept of herd immunity in such a situation is unlikely unless there is a vaccine. I don't need to tell you, everyone reads the papers. There isn't anyone in the United States or the world for that matter who hasn't been affected or touched by the human impact of COVID-19 or the economic impact of COVID-19. So vaccines are essential for the prevention of this pandemic. Now, you might say to yourself, oh, I'm not going to take a vaccine. I don't know what's in the vaccine. So that's why I like this little joke. Let me get this straight. You've eaten hot dogs your entire life, but won't take the COVID vaccine because you're not sure what's in it? Well, I'm here to tell you tonight what's in it. It's very simple. First, there's two types of vaccines that are available today, made by Pfizer and Moderna, and they're both variations of the same thing. Pay attention to this blue ball that you see at the top of the slide. That blue little ball, microscopic ball, is known as a nanoparticle. A nanoparticle is a tiny ball that is surrounded by fat, by lipids. And if you want to know the truth as to why the vaccines have been so slow to be manufactured, one of the roadblocks has been getting sufficient number of these nanoparticles manufactured, because within that nanoparticle sits a tiny little thread of a molecule called RNA. And that RNA is the blueprint that tells the cells what kind of proteins to make. So they collect a bunch of these nanoparticles that have RNA in them, ejects it into your deltoid muscle of your arm, and then those nanoparticles fuse with the cells of the muscle, and then the RNA is released, as you see here, and then the RNA tells the cells to make a very specific protein that is found only in the virus. It doesn't cause it to become a virus. There's no virus in your body at all, but what it does is it alerts the immune system to recognize this protein as foreign. It's sort of like going into the post office and seeing pictures of the most wanted people lined up. If you ever go to the post office, haven't been there in a year, right? But the idea is that these are the most wanted antigens. These viral proteins then stimulate the immune cells in the body so that the next time the body is exposed to the virus, these immune cells are there, ready to go and to fight the virus. And that's what we call immunity. Excuse the physicians in the audience, excuse this simplistic approach, but it is the way in which it works. Now, I don't want you to think if you get the vaccine that you're all of a sudden Superman and Superwoman and only kryptonite can destroy you. That's not true. Although the vaccine is likely to start stimulating the production of antibodies very soon after injection, we don't know when the antibodies will be fully protective. And we don't know how long these antibodies will last for. So it remains very important to continue to wear a mask, to maintain physical distancing, and practice good hygiene, even after you get the second dose, the booster dose of the vaccine. But most of all, I want to leave you with the thought that a vaccine will only work if you take it. Tony, I'll give it up to you now, and we're happy to answer any and all questions that are put before us to the
Dr.
best
Weiss,
of our ability.
thank you so much, Dr. Weiss. That was awesome. And I love the analogy with the hot dog. I really do. That was kind of special. All right, so that sets us up for the Q&A portion of the event. And we're going to turn our attention to the questions that you've submitted over the past few days. And we're actually going to go back to Dr. Weiss. We have the first two questions are for you, Dr. Weiss. The first one goes like this. Can you talk about the new treatments being studied to fight COVID-19?
So when we think about treatments of people who already have COVID, we sort of divide the therapeutics up into people that have early infection and that people have a late infection. There isn't really any medicine out there that can destroy the virus once it's in your body. But what we can do is help your body fight against the side effects of the virus, the inflammatory reaction that the body produces. And so we have something called monoclonal antibodies. And today, UHealth is able to give give two types of monoclonal antibodies, the Regeneron or the Eli Lilly, to anybody who's within 3 days of having a positive COVID test. We believe that by giving these antibodies, this is what we call passive immunity. Instead of getting the vaccine, we give you the antibodies that already are made for you as if you were to have gotten the vaccine, so to speak. And then there's convalescent plasma, you might have heard about, which is the plasma of individuals who previously recovered from an infection that have antibodies, and they are thought to be helpful in the early stages of somebody who may have COVID. In addition to that, we have multiple other medications, including tocilizumab, which is an anti-inflammatory drug, dexamethasone. And here at the University of Miami, we started the initial trials on the use of stem cells in the treatment of at the very end and very critically ill patients with COVID-19 that have severe lung disease on ventilators. But all these things, none of them are perfect. We have remdesivir, which also helps a little bit decrease the length of stay and improve the morbidity associated with the virus. But in general, you don't want to get this virus. You want to protect yourself and stay away from it. Although there are therapeutic drugs that are out there, none of them are absolutely curative of the condition.
Dr. Weiss, thank you. We still have another question for you. What is the timeline to get everyone vaccinated, and what does that timeline depend on?
So as fast as possible. You know, everybody wants to be the first. It's almost, the pandemic has caused pandemonium, if you will. But the problem is that we don't get the vaccines as we want them. we get the vaccines as distributed to us by the state, and the state determines how they distribute the vaccines. And then who does the state get them from? They get them from the federal government. So the federal government dispenses them to the state. The state decides how they allocate them to the various hospitals and other institutions in their state. And Florida is different from New York and Texas and all the other states. So we have to follow the Governor DeSantis's recommendations. And even then, we don't have enough vaccines to vaccinate everybody that wants to be vaccinated. So the timeline is really uncertain, but based on information that was released last night and today, we strongly believe that you'll be able to get the vaccines in CVS and Walgreens before too long without having to stand in line for hours. And you can even go to Publix. When you pick up your nectarines, you can pick up a vaccine. So this is ideally what will be. How soon it will be really depends on the government and not on you, health.
Thank you, Dr. Weiss. Ms. Stella, this next question is for you. What can I expect when I come in for my vaccine, and what do I need to bring with me?
When you come in for your vaccine, you'll be checked in as you are with other appointments. You'll be taken to get vaccinated, and then you will go to an observation area where you will be observed for 15 minutes. During that time, they will arrange for your booster appointment, and you will get registered with vSafe. So what do you need to bring with you? You need to bring your state-issued ID. But the smartphone is very important because that is how you schedule your booster appointment, and it's how you register yourself with vSafe, which is really important. So that's what you can expect.
Thank you, Ms. Stella. Dr. Deblecki-Lewis, welcome. It's nice to see you. Is it safe for people with allergies and blood disorders and other underlying conditions to take this vaccine? And what are the known side effects of the vaccine?
Sure, Tony. Yeah, thanks for having me here this evening. So happy to discuss that. So actually the real contraindications, the things that would prevent someone from getting the vaccine are quite few. So obviously anyone who has a severe reaction to any of the vaccine components should not get the vaccine. The vaccine components are not the usual suspects. So there's no egg or egg material or egg derivatives in the vaccine, for example. There's people with latex allergies can safely receive the vaccine. There really are just a few components that are unique to the way the lipid nanoparticles that Dr. Weiss was describing are prepared and put into solution. And these are sort of obscure chemicals in the polyethylene glycol family that are expected to be probably the cause of some of the allergic reactions you may have heard about in the news. And we can talk a little bit more about that, but they're really quite rare. And most people, even those people who've experienced allergies, environmental allergies, food allergies, can very safely receive the COVID vaccines. People who've had anaphylaxis to anything in the past should be observed for a little bit longer, 30 minutes instead of 15 minutes after they receive the vaccine. But there's really very few exclusions. In some of the questionnaires, you may see questions around blood thinners and coagulation disorders. That's really just to make sure that people can receive safely a shot in the arm. So it would have to be a pretty severe blood disorder, something you would really want to talk with your doctor if you thought that you fell into that category. But really, there's no reason to believe this would cause any bleeding or clotting disorders. And most people can really quite safely receive the vaccine. So there's really no medical conditions that would be an absolute no. People who have some immunocompromise or receive immunocompromising medications, for example, for cancer treatment or for transplant, may not respond as well to the vaccine because of those immunosuppressants. but in most cases, the vaccine is still indicated. So very, very uncommon to find an absolute contraindication to the vaccine. Sorry, was there another part to your question?
Oh, the other part of the question was, what are the known side effects of the vaccine?
Sure, yeah. So most of the side effects are those that happen right after. We call them reactogenicity. So it's your body's reaction. It's kind of the expected immune reaction to getting the vaccine, which is then, as it's supposed to, stimulating your immune system. And it's that immune system stimulation that makes you feel a little lousy oftentimes the next day. So that can be fatigue, body aches, sometimes low-grade fever, just not feeling very well. The good thing about that is it does predictably go away by the third day after the vaccine. Usually it kind of peaks the day after the vaccine, and especially after the second dose. But these are uncomfortable for some people. Not everyone has them to a degree that's uncomfortable, and some people more than others, and usually does go away pretty quickly, as well as some local things, meaning like a sore arm, or a little redness around the injection site. So we know that these happen about the same rate as some of the vaccines that are already out there, like the Shingrix vaccine for shingles, if folks have had that. And they do occur, but they are, they do resolve fairly quickly and are not severe or significant in terms of long-term impact. Certainly much better than getting COVID itself.
Amen. Thank you, Doctor. Dr. Weiss, you touched on this in your opening remarks, but let's go back to it. How long does your immunity last when you're vaccinated? And will this be like the new flu shot that we have to get every year?
So we don't really know exactly the answers to all these questions because the way the FDA works when they approve these vaccines, it's based on about 45,000 individuals that participated in it. And they haven't really had the study ongoing for that long to know. But generally speaking, the feeling is that although immunity may begin as soon as beginning of immunity may begin as early as 1 week, it probably would last a year. That's at least the thinking now. But I think we have to wait until March when we're able to see all the data from the studies, as well as the long-term follow-up that has been done for both the Pfizer and the Moderna study. But I think at one point that we'll get to time and time again is the fact that even though you've gotten vaccinated, do not assume that you're completely risk-free of getting the virus. So please be careful.
Dr. Weiss, thank you. Ms. Stella, what happens after I get my first shot? Is there an observation period?
Yes, there's an observation period typically of 15 minutes. But as Dr. Deblecki-Lewis stated, for certain individuals, it needs to be longer. So they're extended to 30 minutes. And we have nurses in those areas that are observing the patients and are there to answer questions. So there definitely is an observation period, and patients are told ahead of time that they can't leave right after the vaccine. They definitely have to stay for the full time.
Thank you. Dr. Deblecki-Lewis, can you get the vaccine if you currently have COVID?
Right. So if you currently have COVID, it's important to, first of all, fully recover from that. So we want people to be feeling 100% after they've recovered from COVID, and also be outside of the quarantine period that's required for someone who has active COVID. After that has happened, people can go ahead and receive the vaccine. However, it's extremely uncommon to have a reinfection with COVID within the first 3 months at least after the infection. And for that reason, there's no rush to get a vaccine after recovering from COVID. And right now, where there's so much demand and so many people who really could benefit from the vaccine, it makes a lot of sense for people who have recently had COVID to wait a little while and sort of allow others in, because they are very, very unlikely to become reinfected at this point and can have the ability to wait a little bit to go ahead and get the vaccine. But eventually, yes, they should get the vaccine by 3 months after recovering from the virus.
We're going to keep you right here, doctor, because the question goes like this: will the vaccine be available for children? And the next part of that question is it safe for children?
Right. Well, the two go together. So we have to make sure that it is safe and effective for children before it will be available. Those studies have not really been done. The Pfizer product is in ongoing testing right now. Their trials did toward the end start to incorporate children down to 12 years old. So that's the first group that we'll have some data for, are children 12 to 16. Right now, Pfizer is approved for 16 and up. So we can expect that data probably in a couple of months, around the time that the official filing, not for emergency use, but for regular use of the vaccine happens, is the expectation. And then the big question is around children under 12. So those studies are starting and will be happening in order to make sure that they have a dose that's safe and effective. And there's not a clear, clinical trials are a little bit uncertain always until they're completed, but there's hope that these may be done and we should have the data for rollout by the summer is the sort of fingers crossed expectation, because I think everyone would really like to see something in place before the fall. So, again, we have to be optimistic at this point, and that's maybe a general sort of guarded timeline.
All right, we have one more for you, doctor. Don't go away yet. Okay, so here it is can you still transmit the virus when you're vaccinated?
So this is probably the most frequently asked question at this moment. So there's been a lot of talk about whether the vaccine prevents infection altogether or only prevents people from getting sick from COVID. And first of all, I want to say only is an understatement. I mean, if the vaccine prevents people from getting sick and dying, I do think that's a great accomplishment. However, we don't know that it doesn't prevent infection, or it most likely does decrease infection. We have to do a little bit of a tweak in different kinds of studies to prove that that's the case. There's still a concern that it could not completely prevent viral infection in the nose, which may not be symptomatic, but could potentially spread virus to other folks. We need to know a lot more about that, to sort of prove or disprove whether that is the case. But for now, it's a good idea to be cautious and assume that we may not have complete protective immunity, meaning doesn't protect from carrying the virus. And in that case, it could mean that people who've been vaccinated could still carry the virus and potentially therefore transmit to others. So right now we have to assume this could be the case. This is one of the reasons that it's still recommended to use masks and to take precautions even after completing the vaccine series.
Thank you, Doctor. Dr. Weiss, can I get the vaccine from UHealth if I'm not a UHealth patient? And what about my spouse if I am a patient and my spouse isn't?
Great question, Tony. And this question comes up very frequently and is a source of great frustration. Let me explain the situation. We have about 3.5 million UHealth patients in our medical records that are active. We get maybe 15,000 vaccines. So we have to distribute the vaccines that we have in an equitable way to all the people that are most needy. We have been given the vaccines to UHealth in order to vaccinate our healthcare workers that take care of everybody in the community, as well as our patients that come to see us. Now, there are certain guidelines that are promulgated by the National Academy of Medicine, the Center for Disease Control, the ACIP, and general good medical ethics practices. And so we follow all these guidelines to make sure that we distribute the vaccine in the most ethical way, which means that we have to promote the greatest good for the greatest number of people, that we have to be sure that we don't discriminate against people who are of lesser socioeconomic backgrounds, who are actually even more prone to being affected by the COVID-19 disease, and to be sure that we provide it in an equitable way. Now, we could provide it like some places did on a first come, first served basis. And then you saw pictures in the news where people have been standing, poor people, 80 years old, standing in line for hours and hours only to get to the front of the line and be told that they're out of vaccines. So we established a very organized, ethical, transparent mechanism by which our U-Health patients, the most vulnerable, first get the vaccine. And this was decided by a board, a committee, which included Dr. Lewis, included general practitioners, included ethicists, legal specialists, as well as administrators. And we established that for the first run, that we would use individuals 65 years of age and older who had 2 or more CDC comorbidities that were seen in the last year at U-Health, who also have the electronic mechanism by which to schedule their visits, and that we would notify them. They did not have to call us, because as you've seen also in some institutions, the phone systems totally crashed and the computers crashed. We did not have any of that. As a matter of fact, we have although people have called and the call volume has increased, we get back to every patient that calls, and we have never crashed our phone system. And everybody that comes with an appointment for a vaccine does not wait. If those of you on the call might have experienced this already, thanks to Kathy Stella and others, it runs very smoothly. Nobody has to be inconvenienced and stand in line a long time. But having said all of that, we don't have enough vaccines in order to vaccinate everybody. At some point, absolutely, we would love to be able to vaccinate spouses and people who live at home and others who are not U-Health patients. But at first, this is the way in which we could efficiently vaccinate as many people as we can. And if you can imagine the logistics of not just giving the first injection, but being sure that we have to give the booster shot, we think that this has become at least a very functional, ethically fair way in which we can distribute our vaccines to the most vulnerable people in our population. We still have 3.2 million people to continue to vaccinate. Not everybody wants the vaccine, and we are giving it out in the same way. There's a lottery where people are randomly assigned in their comorbidity group, and they're called in turn. They don't need to call their doctor. They don't need to get a prescription. They don't need to call us. We'll call you and set up the appointment and give you the vaccine at the slots as they become available. Sorry for the long-winded answer, but it's really an important topic.
That was beautifully answered, Dr. Weiss. We're going to keep you here, Dr. Weiss, with us. Does the current vaccine...
I'm not going anywhere, Tony.
Well, we're here together, all of us. Okay. Right. Does the current vaccine protect you against the new strains? And besides being more contagious, are the symptoms worse?
So this is a line I stole from Dr. Lewis. This is the first birthday of the virus. And so as you get older, you see your children, you think you know what your child is like, but by the time they turn 1 and 21, and my parents are probably in the audience, and when you turn greater than almost 70, you still, you start changing. And so the idea is that the viruses change. That's what they do. They have little mutations here and they have mutations there. There's the United Kingdom virus. There's the South African virus. The only thing we know is that we do believe that because the way these vaccines are prepared, they are ready to take on and can tolerate certain changes and certain mutations. So the vaccines will be fine, we think, and our testing, PCR testing, will be fine for all these new variants. And although there may be some preliminary indications that they're more contagious, they're not necessarily more virulent. So that's the point that we have. Don't panic over this. We expect it. Every virus mutates, and that's what viruses do. And so we will adapt to it just as viruses do. But the vaccines and our testing protocols are all okay for the variants that we've seen thus far.
Dr. Weiss, this was just sent in to us. Why is, and you touched on this with your slides actually, why is herd immunity unlikely unless there is a vaccine?
Well, the problem is that for herd immunity to really take place, you have to have infected 70, 80% of the population with antibodies at the same time. That's not likely to happen given the natural history of the disease anytime soon. And people who are asymptomatic are spewing out the disease. If you give a vaccine to a massive number of people at this relatively same time, then they all develop immunity. It comes from the early days of veterinarian medicine, when they would give a herd of cattle would get infected, and maybe 1 or 2 could pass by because they would act under the good graces of the majority of the population having been protected, and they would too be protected. But without the vaccine, there'd be no way in a reasonable time that we would be able to protect the population.
Thank you, Dr. Weiss. Dr. Deblecki-Lewis, is the vaccine safe for pregnant or nursing women?
Yeah, so this is a question that's been addressed by the FDA as well as the CDC. That the clinical trials that were done to evaluate the safety and efficacy of the vaccines did not include pregnant women. So we don't have specific data from those trials. We do have animal studies that look very reassuring, meaning there doesn't seem to be any likely impact. And based on the way that the vaccines work and the way that mRNA works and how it's cleared from the body, there's also most scientists expect that these are safe for pregnant and for lactating women. The way that the recommendation has been phrased is really that each woman should weigh the potential benefit of the vaccine. We know that women who are pregnant, if they do become infected with COVID, unfortunately have worse outcomes than people who are not pregnant, for both themselves and for the baby. So for that reason, for women who are working, who are encountering or in situations where they may encounter COVID, it's advised to have a discussion with their provider, and if they choose to receive the vaccine, then that's absolutely a reasonable decision. For other women who are able to isolate and may be able to take other precautions against the virus, they may choose to wait. So it's left to a woman to decide, but there is no indication that they are unsafe in pregnancy.
Dr. Deblecki-Lewis, we just had this sent in. Is it safe to fly for children and adults now? I know this is a debate, major debate going on pretty much in many, many households.
Right. So, this is such a tough question to answer, right? Because flying is such a different experience every time I do it. haven't done it in a while. But it's not just the flying, of course, but the going to the airport, the waiting in the lines, the getting there, getting back, and all the other things that go with transportation. I think, it's tough to say. We know that the absolute risk from being on a plane has been calculated to not be very high. But again, I think it's more all the other things that happen when you're in a traveling situation that are concerning to me. So, it's again, a risk benefit thing. If you're going somewhere that you really need to be, and it's critically important, I think taking extra precautions during transportation, including flying, is essential. And if you don't have to do it, it's better not to. So I have to give sort of a hedge there, but these are the situations and challenges that we face every day right now, trying to weigh risk and benefit for all of our activities.
And I'm sure it really does thrive on overthinking when they have to do this because of all the situations that you just brought up. Ms. Stella, what are the plans for vaccinating UHealth patients in Broward, Palm Beach, and Naples?
Well, right now, we don't have immediate plans for a vaccination site in any of those areas. I think that it's really largely because of the limiting factor, which is still the vaccines. And at the same time, it's also that a lot of community vaccination sites are coming online. So what we've done, as at the onset of this, is we've been able to adapt as needed. So we don't have immediate plans now, but if needed later on and the supply was there and we were called to do that, we would certainly adapt. But so far, there are no immediate plans.
Thank you. Dr. Weiss, this next question, believe it or not, someone asked me, and I certainly didn't have the answer. So hopefully, I know you will. What happens if you get the first dose from Pfizer and the second one from Moderna, or vice versa? Do you have to get both vaccines from the same company?
Absolutely, you do have to get the same vaccines from the same company, and not only from the same company, you should get both vaccines from the same site. In other words, if you went to Hospital X, you need to get both from Hospital X, and they should both be either the Pfizer or the Moderna. It's like going into a shoe store and telling the person you want the left shoe, and you leave the right shoe. And then you go to another shoe store and you buy only the right shoe. So then what do the shoe stores do with each of the? So our allocation of vaccines is really based on where they get the first one. And then we're promised to get the second vaccine in the same place. Now, why it has to be, that's why it has to be in the same place. Why it has to be Moderna for Moderna and Pfizer for Pfizer is that the vaccines, although similar, are not identical. And in order to achieve the same level of immunity or immunization from the vaccination, you want to be sure that the RNA that you're getting is the same RNA because it's a booster. So although the timing of the vaccine can be plus or minus a few days, don't get yourself crazy if you don't go exactly at 21 days for Pfizer or 28 days for Moderna. It's perfectly okay. What you need to know is that you get it, and it's okay if you're a little bit late. But yes, it must be from the same company.
We're going to keep you here, Dr. Weiss. We have another one for you. When you open up vaccination to the public, can out-of-state residents get their vaccine at UHealth?
Well, we're bound by the regulations and the executive orders of the state government first, because that's who we get the vaccines, and then from the federal government. There isn't always a line of sight between the federal government and the state government, and so although there is no direct reason why someone from New York couldn't theoretically come to Miami to get the vaccine, it certainly wouldn't be possible now, because they would have to meet the criteria at UHealth to being a patient, to being seen in the last year, and so forth. What really becomes a little bit problematic are people who are not residents of the United States, because an executive order says is that the vaccines are specifically for individuals who live in for residents of the United States. So there's a lot of medical tourism that goes around. And I can tell you last week, I got 10 calls from Mexico City of people who automatically, all of a sudden they came down with diabetes and they had to be seen right away. And we knew that the reason they wanted to come was because they wanted to get the vaccine, but we're not really allowed to give the vaccine to non-residents per executive order of the federal government.
Dr. Weiss, this was just sent in to us. Can you elaborate more on the Johnson & Johnson vaccine and trial?
Actually, I'm going to defer that to Dr. Dublecki Lewis, who is our PI on the Moderna trial and is intimately aware of all the other trials going on, if it's okay.
Sure, no problem. So the Johnson & Johnson vaccine trial just wrapped up pretty recently. I think we're expecting data to be submitted later this month, is my understanding. The vaccine itself is a little bit different than the Pfizer and Moderna vaccines that we've been discussing. Those are mRNA vaccines. The Janssen or Johnson & Johnson vaccine is an adenovirus 26 vector. Adenovirus is a weakened cold virus. This is a virus that's been manipulated so that it doesn't replicate in the body. It can't make copies of itself, but it can serve as a carrier for a bit of the COVID DNA. So it's a little bit of the COVID DNA stuck into a vector that is a cold virus. So it's quite a different way of doing things than the mRNA. The other thing that we know about the Johnson & Johnson vaccine is that it's being tested as a one-shot deal. So, so if that vaccine is approved based on the phase 3 trial that just completed, it would be one dose, which obviously would be very helpful in terms of getting vaccine out to large numbers of people. And it also can be stored at more regular temperatures that are like regular vaccines are, refrigerator temperatures. So there are some advantages to that vaccine. I hope that we do see it have good results. We'll know when it goes through its EUA process, and that would be great to add to the armamentarium.
Dr. Dublecki Lewis, stay right here because we have another one for you. How long does it take for your immunity to kick in after you receive the vaccine?
Right. So what we can see pretty clearly is that people who receive either the Pfizer or Moderna vaccines around 2 weeks after the first dose start to ramp up immunity quite quickly. It doesn't reach full levels until close to the second dose, looks like, and then sort of increments up just a little bit after the second dose. In about a week or two after the second dose is probably at its max. The second dose we think is important probably to boost longer term immunity. But you do start to build, but the first 2 weeks, folks really don't have much protection at all. So I think that's important to keep in mind as people are being vaccinated. It's still quite important to be very careful in between the first and second doses.
Thank you, Doctor. Ms. Stella, while you won't be opening sites outside of Miami, this was just sent in, by the way. If you are a patient but live in Broward or Palm Beach County, for example, will you still get called per the parameters that we discussed tonight, or not because you don't live in Dade?
Now, the parameters are based on the state mandate. So if the patients are in Broward, but they fall into those guidelines, they will be part of that algorithm as Dr. Weiss described earlier, where they will be selected and randomized, and they will still get an email. And actually, we have seen quite a few patients from Broward, so they would certainly be included as well.
Thank you. Dr. Dublecki Lewis, after the second immunization, what can we safely do and what should be avoided?
Right. Great question. Possibly disappointing answer. So I think after you get your second dose, you can be reassured that you are significantly protected against severe COVID disease and symptomatic COVID disease. However, right now with so much COVID circulating in the community, if you're here in Miami-Dade, we're just having astronomical levels of circulating COVID, it's still extremely important to maintain all of the precautions that we currently are. There are several reasons for that. So one is what we discussed earlier. We don't know that you can't carry the virus and not have symptoms from it. So you can't be sure that you can safely be with others, even after you've received protection yourself. Not everyone has the same immune response to the vaccine. The volunteers in the trials were not significantly immunocompromised and generally had quite good immune responses, but not everybody's the same. So, we have to be quite careful. And someone's made the analogy of the Swiss cheese approach. You don't want too many holes in your defense. So vaccine is a great protector. So are masks, so are maintaining precautions. And I think right now, until we see levels in the community drop significantly, that's where we are. No big lifestyle changes.
Yeah, we want to see full armor. We just don't want to have a bulletproof vest and that's it. Dr. Weiss, or rather Deblecki Lewis, after the second immunization, we talked about that, but then Dr. Weiss, will there be enough supplies of the vaccine for the second dose? I know that a lot of people are wondering about that, and you maybe sort of touched on it, because if you get the first dose, I'm assuming you're guaranteed to get the second.
You're guaranteed to get it as much as the state will be able to provide it to us. If you asked me this question last night, I don't know how I would necessarily have answered it. But luckily today at around 11 a.m., FedEx delivered the next doses of Moderna that we need for the second for the booster for all our patients who got Moderna the first time, and a few extra so that we can continue our immunization of the high-risk patients at UHealth. But still very, very limited, and we don't know when we'll get the next batch. But for now, we can guarantee everybody who got the first will get the second.
Dr. Weiss, we're going to keep you here because this question came in as well. What vaccine would be better for a transplant recipient and cancer patients?
All the vaccines will be equally efficacious and safe in all patient populations. There's no reason to say you want Pfizer over Moderna. Unless you have stock in one over the other, but there really isn't any medical reason to want one vaccine over another. There are reasons why it will be easier, as Dr. Deblecki Lewis stated, when the Johnsons & Johnsons and the AstraZeneca Oxford vaccine come out that don't necessarily need refrigeration, will make it easier for the community providers to dispense it. But right now, there's no reason to want one vaccine over another. And we have no way, of promising anybody when they come for their scheduled appointment what vaccine they're likely to get until they show up.
Okay, Doctor, can you describe, this was sent in, so we'll just stay with you. Can you describe more about comorbidities and when we can expect under 65 patients to start to be vaccinated?
So the comorbidities that we are looking at are factors that are conditions that we know put people at more severe risk of getting the COVID-19 disease. Above and beyond all, the one thing most determining this seems to be age. And after age, there are a whole bunch of other things, and you can find them on the CDC website, what they are. However, it's true that the CDC website doesn't include other things like inflammatory bowel disease or that for people where they're getting immunosuppressants, or neurologic conditions where people are taking prednisone for long periods of time, or other types of immunosuppressants. So we do hope that after we vaccinate the most vulnerable group, we'll go to the next most vulnerable group. The timeline for this depends completely on the supply of the vaccine from the state.
And Dr. Weiss, another one sent in, is there any data to support President-elect Biden's vaccination plan to release the full supply and not set aside that second dose?
So that's a hotly contested question, and I don't want to have there's no politics here. There's only science where we are, and that's what our business is. And we don't yet know what the change in efficacy would be if we were not to give the second dose. All the trials, all the data, all the work that Dr. Deblecki-Lewis and her team have done for looking at the Moderna trials, all based on a second injection and the efficacy. So then there becomes an ethical question. Is it better to vaccinate more people, only providing them with 52% protection, or vaccinating fewer people and providing them with 92% immunity? So the answer to that question is difficult. The science is not yet out or available, so it remains a question in the realm of ethics.
Dr. Weiss, thank you. And thank you to all our panelists tonight who have helped us go through this. I mean, we could be here for another couple hours. That's our last question. But before we close tonight, I think it's important that we ask Dr. Weiss for some final thoughts. And Dr. Weiss, I have to tell you, first of all, of all the ones we've done, I have never heard any doctor have the best analogies ever. Whether it's the hot dog or the left or the right shoe, I have to tell you flat out, they were absolutely spectacular. So thank you for that. And now some final thoughts.
Well, thank you, Tony, for moderating tonight's town hall, because I can tell you, a compliment from you means something, because you MC things from Orange Bowl to Rose Bowl to all sorts of things. And so if little us in the vaccine world, it's an honor to have you here. But I really appreciate the opportunity to interact with our patients and our friends that are on this call. And I want to recognize again the work of our emergency management and operations staff that included Catherine Stella, who was on the call, but others that weren't on the call, like Vincent Torres or Stephen Demers or Janet Yearn, and I can go on and on. We have a CEO of UHealth Hospital, Dr. Kim Manny, and a CMO, Dr. Tanera Ferreira, and all these people and multiple other people, they're the ones. And Dr. Deblecki-Lewis, if I can speak for her as well, and I are really grateful for all the physicians at UHealth, all our colleagues who are very committed to being among the very best in the world to do what we do. The enthusiasm, commitment, and expertise of all our physicians reflect the kind of drive we need to successfully develop even newer vaccines and newer treatments against COVID-19 and other vexing diseases, because unfortunately, this will not be the last. Most importantly, philanthropy helps to ensure that we have the very best people and we provide them with the best resources and infrastructure to make an impact on the world. I want to acknowledge the generosity of the Board of Trustees, our leadership, and thank all our faculty, staff, and loyal donors. And you, all of you who are on this call, to continue to help us set up new standards of care. You inspire me to come to work every day and to do what I do. So thank you very much. And thank you for giving me the opportunity tonight to share my thoughts and those of my colleagues.
Dr. Weiss, thank you. Dr. DeBlecki Lewis, thank you. Ms. Stella, Catherine Stella, thank you so much. And thank you all for participating in tonight's In the Know Town Hall. What an amazing hour that we've spent together, right? I mean, it flew by, not just with incredibly talented doctors and administrators, but ones with passion and a laser-like goal of serving our community with the utmost care and the utmost expertise. We are also blessed and so very fortunate to have heard from them tonight, but most importantly, that they are all part of the U family. Please remember that a full recording of this program will be posted online. Look for that link in the coming days. And if you would like to give to UHealth's COVID emergency relief efforts, visit med, that's med.miami.edu/giving. We will also send you that link as well in an email. Now, in a moment, you're going to see a survey about tonight's town hall on your screen. Please just take a minute to submit your feedback, please, because what this is going to do, it's going to help us understand your interest and improve our program, because we always want to make sure we're up to date and making sure it's a value proposition for all of you who join us during this hour. As always, we wish you and your family good health, stay safe, and remember, it is always about the you. Good night, everyone.